Welcome to the Global Impact Charity Voices series, a way for you to connect with the charities and causes you care about most.
Today, we're speaking with Partners in Health, a global health organization fighting healthcare inequality around the world and here at home. Their work is more important now than ever as we face the coronavirus pandemic. We're so glad you could join us.
Hi, everyone. Welcome back to another Charity Voices series episode. Today, I am so excited to be speaking with Laura Susi with Partners in Health, or PIH. Laura, it's so great to have you here today.
Thank you so much, Jillian. It's great to be here.
Yeah. So, there's a lot that we could talk about with Partners in Health's work. And there's so much that you do, especially built around this premise that really speaks to me about this idea that health is a human right. But to get us kind of started, I'd love to hear what draws you to the mission of PIH and what's something that people don't know about your organization.
Yeah, one thing that many people might not know about Partners in Health is that we have 19,000 staff, or almost 19,000 staff worldwide, working throughout the 11 countries where we work. And 99% of those staff are from the countries in which they're working. And also more than half of them are nurses. So of course, while our primary mission is to provide top high quality healthcare in marginalized communities, by hiring and training locally in the communities where we work, we're really addressing those root causes of poverty and providing meaningful opportunity for long-term work. And of course, economic stimulation. And it also contributes to positive health outcomes because, when you have community members going out and working with their neighbors, providing care and treatment and education, there's a real trust that's built there. And that can really help to ensure that follow through of all different types of treatments are taken seriously, and that there's communication that is readily available because it's folks right there in the community.
Great.
So PIH is an organization that has always been driven by optimism, and like many, including yourself, my first introduction to PIH was by reading Mountains Beyond Mountains as part of a course in college. I was studying environmental policy and geography, and so through a lot of that coursework, I think I just felt very immersed in doom and gloom, and overwhelmed by the compounding problems of suffering and injustice, and so really having this opportunity to read and discuss Mountains Beyond Mountains by Tracy Kidder in one of my classes just offered so much hope, and it was really a beacon of light. I think the simple approach that Partners in Health takes to healthcare just made so much sense, and just felt like such a realistic solution in so many of these communities that are plagued by poverty. And I think that's what's drawn so many supporters to Partners in Health, to the boldness of our mission and of our leaders, and these simple yet effective long-term solutions that put the communities first. And so when I had the opportunity to work for Partners in Health as a temp, just after the 2010 earthquake in Haiti, a time when so many of us were just staring at our television screens, feeling helpless as we watched the horrific images on the ground in Haiti, and so feeling like even if just behind the scenes doing data entry and financial reconciliation, that I could be a part of that positive force was just really an incredible moment. And so now, almost 11 years later, there are new things every day that we get the chance to learn about that continue to draw me to the work of PIH.
Great, thanks, Laura. And so with COVID-19 on everyone's minds, I know that PIH has been doing a lot of work in this space. So would love to hear, what your work looks like right now, how you've had to change and adjust, and what that response looks like abroad and here at home in the United States.
Yeah, so COVID-19 has, of course, dramatically impacted our work, as it has for most everyone at this point. So immediately we, of course, began working remotely, but our leadership began daily calls with our staff around the world. So, hundreds of people joining every single morning to discuss, the latest on the pandemic and share lessons learned, because of course, it was hitting different geographies at different times and varying severities. And, really in a lot of places where we work, Rwanda, for example, we already have a really robust community-based approach. And so many of them were already really poised to fight the pandemic, in a much more sophisticated way than we are here in the U.S. And so really learning from each other and checking in every day was a huge part of kind of the early days. But really our goal as an organization through all of the pandemic has been, of course, to minimize COVID-19 and the toll that it's taking, and to keep our staff and patients safe. But to ensure that our regular ongoing work is uninterrupted, as much as possible. So, women still need obstetric care, kids still need malnutrition treatment, cancer patients still need chemo, emergencies still happen requiring urgent care. So across all of our sites, we've just been working to make sure that we can keep all of these services available, especially to the most vulnerable people, and do that while keeping our staff and our patients safe. Another significant and exciting change for us has, of course, been that we are now working domestically in the U.S. So we did work previously, we still work, but had already had a relationship with our sister organization called COPE in the Navajo Nation. But other than that, had not worked in the U.S. And so we were asked by the state of Massachusetts to partner with them to build a large-scale contact tracing and testing program, and also a way to ensure that especially the most vulnerable people had access to services that would provide social support as needed, as people have to isolate and quarantine. And so that has expanded across the country. I think we're working with at least a dozen state and local municipalities now, in different ways and different levels of partnership, but really focused on that contact tracing and also kind of this centralized knowledge center where learning collaborative, where frontline clinicians and leaders and public health experts can come together. And we've been, because of our history as an organization of fighting infectious disease like Ebola in West Africa in 2014, and our long history of treating HIV and TB, we really do have so many lessons learned that we can share, with our peers to hopefully get life back to normal at some point. So we've created an entire new arm of Partners in Health called the U.S. Public Health Accompaniment Unit. And like I said, it kind of started and bloomed out of this partnership with Massachusetts, and is now making its way into other parts of the country. So it's definitely been a very pivotal moment for Partners in Health, but we're really, really happy to be able to share this expertise.
That's great. Pivoting really quickly, I'd really like to talk about the connections between racial injustice and inequities in health access and health outcomes. We've been having really critical conversations as a country about racial inequity, and PIH has been having these conversations for a long time before they were trending. And so would love to hear what your organization is thinking about and the work that you're doing in this really important space.
Yeah, great question. So there's a really well-known quote from one of our co-founders, Paul Farmer, that says, "The idea that some lives matter less is the root of all that's wrong with the world." And I think, this is and always has been kind of our guiding principle and really our most important core value of Partners in Health. All lives are equal and all human lives deserve, the chance to fulfill their potential. And we know that, of course, health is central to that. And really what is going on in this country and around the world has been, structural racism has been a public health emergency. And not only because of the unjust, brutal murders of George Floyd, among so many others in Black communities, but because of the ongoing oppression that has continued to create systems that don't allow access to healthcare and to to fulfilling potential because of just these systems that continue to keep people down, particularly in the Black and Brown communities, both here in the U.S. and around the world. So people who are living in poverty due to these centuries of oppression that are rooted in systemic racism, I think PIH believes that they must receive a preferential option in healthcare because the playing field needs to be leveled for people who have been born at a disadvantage, right? And it's our moral responsibility to fight these age-old injustices, and we do that by of course through healthcare, but also by using our voices to advocate and to advocate for radical change and through a lens of love and compassion and empathy, of course. And so our approach is to empower communities to listen and to let communities lead, because of course, they know what is best. And I think, today, thinking about COVID, we really can see how many of these inequities have been exposed. Even just thinking about here in Massachusetts, in one of the wealthiest states in the country, our contact tracers have come across families and people who in marginalized communities who are not able to isolate, who are not able to not go to work because this is just not an option for them. It's survival. There's, the idea of having to find childcare or not, being able to have your normal way of getting food. These are real problems that are happening right here in Massachusetts. And so it just kind of goes to show that, COVID-19 has drastically, disproportionately impacted marginalized communities and exacerbated the existing vulnerabilities that we have known for a long time already exist, but for many, just it's the quarantining and the isolation is just not an option. And so we work to ensure that we can link people up with social support that might be available to them, and it looks different here in the U.S. than it does kind of in the way that we work with at other sites, but there have been some great services that we've been able to partner with to make sure that the people do have access to that support. And so we know this is a very long and complex, challenging battle, but I think Partners in Health is always just we do whatever it takes, and we'll just keep working to hopefully both reach more people and spread our knowledge and our approach so that it can be replicated across other communities in the world as well.
Yeah, I like your point that this is a global conversation, right? And we've spent time thinking about the work that our charity partners are doing here in the United States with these conversations, but I mean, this is of global concern, and these problems are echoed around the world. So I appreciate that. Last question for you. This can be about PIH as an organization. This can be about you personally, but over the last few months, what's something that you have learned about resiliency? What does that mean to you?
Yeah, I definitely see so much resilience every day with my coworkers. You know, just starting with people who are at home trying to balance childcare with really stressful and emotionally tolling work, with all of the other issues that we're surrounded with every day in this country, and just kind of being able to navigate through all that and still work tirelessly and produce really quality work and be there for each other. I think that has been really incredible to be a part of. And, you know, with the leaders of our organization who, especially at the beginning of the pandemic, I think some of them, like Joya, just were working 24/7 and just putting absolutely every ounce of energy and time that they had into trying to fight this pandemic, especially at that critical time in the beginning. Um, and you know, always kind of referencing back to the original question, I think always with that optimism that is so important to get people through these times. And then just thinking about and hearing from all of our healthcare workers across the world. I had a conversation a couple of weeks ago with a community health representative in Navajo with our sister organization, COPE. And, you know, she was just explaining all of the challenges and the fears. And, you know, we know Navajo was hit so hard by COVID-19, and, you know, it was scary and resources were scarce, and there was just so many unknowns. And, you know, these health workers just got up every morning and went out to ensure that they were there for their communities, that they could, you know, spread that kind of trusted information and provide care as best as possible while staying safe. And, you know, there's just thousands and thousands of community health workers throughout all of our sites. And of course, everybody, all of the healthcare workers here in the US who are putting themselves and their families at risk and working in really, really non-ideal situations to continue providing care. And obviously, you know, without them, none of this would be possible. So I think when I just think about resilience, it's kind of in all those different levels of colleagues around the world and healthcare workers.
Well, thanks so much, Laura. This was a really great conversation. Really glad I got a chance to talk to you. Thanks for joining us today, and thanks for all the work that you are doing and that Partners in Health is doing to ensure care for patients around the world.
Thank you so much, Jillian.
That's all for today's Charity Voices series. Thank you so much for joining. Stay up to date on the work of all of our wonderful charity partners by following Global Impact on Facebook and Twitter, and visiting our website, charity.org/give.